So I guess the first thing, you all had a chance to take a look at the minutes from last meeting. Any additions, changes? Good. So I have a motion to accept the
Motion.
second. All in favor?
Aye.
Any opposed? So the minutes are passed, and so we can move right to the director's report, Sam. So thank you.
All right. Well, I'll start with an apology. I developed some sniffles this evening, and I said, well, why don't I take a COVID test? And even though it was expired, it turned positive pretty quickly, and so I took 2 more of a different brand, and all 3 were positive. My wife took 2, and hers were negative. So being that I have symptoms and 3 positive tests and a control group, I figured probably best that I stay away.
Thank you for not getting us sick.
I hope you're feeling all right, but I'm sure.
It just felt like allergies. I just kind of was like repetitively sneezing, and I had this tickle in my nose, and I said, you know what, let me see. And I just got back from a cruise yesterday, so I'm figuring, I probably had some exposure. So. Yep. So we'll see how it plays out, how I feel tomorrow. But so just to go into my report, and we did submit, each year we have to submit an annual report to the Connecticut Department of Public Health. And so Santina, Mary, and a little bit myself worked on that report and got that in a timely manner. I did have the opportunity to participate in what's called the state EPPI exercise. It's an emergency preparedness initiative exercise that the state does once a year. This time we had the Region 1 was the only region that did this, but we collectively, you still hear me?
Yes. Hi, did someone else join? Did someone join the call?
Hi, it's Sally.
Hi, Sally. Okay.
All right. So, so this Region 1 did something different where we had every town gather together, representatives from every town gathered together at Fairfield U. We had about 180 people there. It was actually a very good, fast-paced exercise from the state, presenting a variety of different scenarios related to IT and the impact of IT outages and other issues, ransomware demands and things like that. But it was actually a very good exercise. There was from every town, there was police, fire, emergency management, health, and IT there. So it was actually one of the best exercises I've of these EPPI exercises that the state has ever done. So, but a big success. The deputy commissioner of the state's Department of Emergency Management and Homeland Security came down and said some kind words about how impressed he was about Region 1. But it was nice to be a part of that. In addition, I attended. We had on June 25th the HIA Health Improvement Alliance Community Coalition meeting, where we get together with all folks working on health improvement initiatives throughout the region. And I would say we had about 50 people there from various health departments. We had 3 from our health department, myself, Santina, and Emma Sharp. And I was involved in sort of the presentation and then ran one of the 4 focus groups that we had, with each group working on different aspects of how do we improve the Health Improvement Alliance and other issues. And so it was a very productive meeting. We continue to have CDC calls on H1N5. They're happening not weekly yet, but between the state and the CDC, they're happening nearly weekly with updates about what's going on. We did complete our 5-year preparedness grant cycle this past at the end of June, and we are awarded another preparedness grant for the next 5 years. So it'll be, that grant is typically around $36,000 a year, and so we use that to support our preparedness, a part-time preparedness staff to work on the deliverables related to the contract. So we're happy to have that going again and for another 5 years. The town and the department participated in the fairly large Juneteenth event at organized by the select person's office on the grounds in front of Sullivan Independence Hall, where we had a great speaker from Fairfield University talk about the reasoning behind the holiday and some of the history of slavery in Fairfield. And it was, a sobering talk to hear of it so close to home. But as he mentioned, it's it should be remembered, not with necessarily celebrations, but with happiness that it happened. But that on June 19th, when the soldiers finally reached Texas, that the last slaves were freed. It was, anyway, an interesting, educational, sobering kind of event. We did issue, got involved with 2 homes related to hoarding / one of them had a power issue where the owner turned the power off on the tenant in an attempt to get them to vacate the dwelling. Actually, we were involved in this, and then while I was away, Santina signed off on an order to order the owner to restore power. And Rob has made communication with them that he'll be working on that, the owner, that he'll be working on it as soon as possible. We did have one unfit home declaration that was resolved this past week, so we're happy about that. In addition, Santina signed off on an order for rodent issues at a dwelling on Ruane Street that was been sort of a habitual problem, related to feeding wildlife. And 2 final things. One, we're happy to announce the promotion of Kim Nguyen, our sanitarian, who went from a sanitarian B to a sanitarian A, having completed all their certifications and licensures. So we're happy about that. And then lastly, with some sorrow but joy for her, I'm share the announcement that Jill Mitchell will be retiring as of August 1st. So we'll all miss Jill, but we also appreciate the great work that she's done over the years, both as a school nurse and coordinator and as the nursing supervisor. So that is my report.
Wow. That's great for Jill. Sam, thank you very much, and I hope you feel better very soon.
Thanks, Mark. I appreciate that.
Sure.
Sam, Jason, just quick question. For Jill, do you have a replacement lined up, or do you have posts that we can share to try to help fill the position for you or anything?
Not yet. So we will, the town process involves us, I was actually away last week on vacation, and the town process has us look at the job description, make sure it's still accurate. So that's what we're in the process of right now. We hope to sometime this week post the position. Has to post for 2 weeks, or in this instance, or until we find a qualified candidate. Then we will, once the 2 weeks has passed, we'll start the interview process with the candidates. That'll typically be myself, Dr. McDonald, and hopefully Jill will be available to participate in those. And so we will. That's the course it'll take, but we probably won't be able to get someone till sort of the mid to late August with the way things work with vacations and people being away.
Well, the nursing world is tough now, so certainly share the link, and I'm sure we can all share it to our colleagues and see if we can help fill that post for you.
Sure, we'll send it to the whole board.
Yeah, I can ask around. I know a lot of nurses who have done who work in the hospital, have done work in the school, so maybe somebody for sure. Okay, great.
Me?
Yes, Santina.
Okay. So just a few things. One, back in May, I attended a week-long incident command management training. So it was ICS 300 and 400, and so it's just like an upper level of emergency preparedness. And so the state has really encouraged that upper management for health departments be trained in it, and so I was lucky enough to kind of have a lull of a week, and so I did the training here at the Fairfield Fire School. We've been working on our reports for a few of our grants. So the ELC, so that's our COVID money grant, and our immunization grants, the reports were due. So we still have some money left there to be spending, which we have plenty of time to do that. And then with our immunization grants, we do have, I think at one of the last meetings I did announce that we have, her name is Chloe, she's our community health worker, part-time. But we did finally hire an immunization nurse, and her name is Jennifer. She's also going to be part-time. So they're going to be working on Mondays, Tuesdays, and Fridays. So that kind of offsets the schedule of our current public health nurse, Julie, who works Mondays, Wednesdays, and Thursdays, just so that we have increased capacity. And so Jennifer right now is really doing a lot of the trainings, and she'll be shadowing Julie, and our hope is that by mid-August, we can really even vamp up her hours to help with the childhood vaccines. So they'll be doing childhood vaccines, COVID vaccines, flu vaccines, and anything else. And what's nice is they do have that flexibility to do some homebound visits, so we'll be able to increase that capacity this fall and winter, as well as increased hours. We're hoping probably about once a week or so. And the thought is maybe even with childhood immunizations, we close at 4, which can be really difficult for parents to get to our office. So if the need is there, they will be available for that as well. In June, we did hold 2 Know Your Numbers screenings, and we screened 17 people, mostly town employees. But again, we were checking their BMI, so their height and weight, their blood pressure, and their A1C. So it was a really good turnout. And then lastly, I hope everyone got an email from me last week or 2 weeks ago about our survey. So as you know, we're doing our community health needs assessment. And so we have the Siena Research Institute is doing those phone calls where we're really urging people to pick up the phone to do that survey. And we'll get about 200 responses. But the link that I sent you is that smaller survey. It takes about 5 minutes to complete. If you haven't completed it, please do so and share it. And as of 7/2, so our partners will get a report from Data Haven the first of the month, kind of telling them how many people have filled out the survey. And as of 7/2, 331 were filled out for Fairfield, and it is by far the highest amount. The next highest was Monroe with 119, and then everyone else. And this is a statewide initiative. So please continue to share it. Today, Emma Sharp was actually at the senior center doing it with the seniors. So we said, okay, this is a group we really want to hear from. Yeah. And, the survey may have some technical issues. So she was there with some computer set up, helping them fill it out. And we also had paper copies that we can then input. So she was doing that today. She'll do that next Monday, her and Chloe. We're hopefully going to do it at the library at some point this summer because we will be getting respondents until August 31st. And Sans told me today that he has a goal of us hitting 1,000, so he told me to get creative. So while we're doing great, please share it so that we can, it's really good data, and it's a really quick and easy survey to kind of capture.
I did it.
That's great.
Yeah,
it was really easy.
That's great. I like the idea of doing it at the library. I think that's a really good idea, just hitting people really quickly.
Yeah.
And it's been busy there at the library.
Yeah.
This summer, so.
Well, I'm schools have like reading nights and stuff too.
Yeah.
Reading nights, you said, at the?
Yeah, like elementary school has like a reading night where
they
read a story and
there's like competitions going on too. Like I just went randomly, what day was it? I don't know, Wednesday I think. There's so many people there because there's different competitions for the schools going on. So the kids are running around and the parents are there.
Okay.
So
great. If you think of any other locations, please let us know. We sent it to all of you. We sent it to the RTM, the Board of Education, the state reps,
Board of Finance.
Board of Finance, like any board that we can think of, we sent it over to them. And I know the Bigelow Center sent it out in their email. I know Jen Lieber sent it out last week as well. So we're just really trying to, get it. The unfortunate part is we don't know where we're at right now. So we really won't know until August 1st. But again, we're really just trying to get as many responses as possible.
Do you get the opportunity to give feedback to the people that make the phone calls or anything? Because I'll say that I actually received a phone call.
Okay.
And I said, sure, no problem, I just can't do it right now. Just a bad time, you can call me back any other time. And I've yet to receive the call. And that was shortly after our last meeting last month. Yeah. So I said, sure, I'm happy to. I didn't blow them off because I knew what it was, obviously, from being here, they never called back.
And is that something we can, contact Mark about, or?
Weird.
Yeah. I doubt it. I think the survey team from Siena College, or the Siena Institute, they have protocols that dictate all the callback issues and all that. So it's unlikely, but we can ask him. Yeah.
And I think that's it for me.
Thank you very much, Cynthia.
So I saw, was it the Supreme Court ruling about the opioid settlement with Purdue? Does that impact the grant funding that the town has or anything? Because don't we have an opioid grant that we use, so it could impact that? So I thought it was saying that part of the grant wasn't okay, or somehow.
Yeah, so with the opioid grants, there still are some lawsuits out there pending, and so we know they've set up what we expect to get over the next 18 years. So the town of Fairfield will get around $650,000, but over the next 18 years, and we've already received, I want to say, a little over $140,000 of that upfront, and then as the settlements come in, there may be additional things, and the timing may differ because some of the, I think the defendants have decided just to pay it all at once, and then others have decided to pay it over time. So at the end, we don't know the total dollar amount so far and exactly when we'll get it, but at least we know that over the next 18 years, we'll get about that dollar amount that I had mentioned.
Okay, so no potential taking away from the town based on the recent rulings or anything then, so everything's in a good place. Good.
That's great. All right. So were there any communications from public?
I had none.
Have any?
Any old business or unfinished business that we wanted to talk about?
I have none.
Is there any new business that we need to talk about?
I have none.
Any comments? Anybody who's on the call, any other comments before? So I can make a motion to adjourn. Okay. So,
Well, thanks everyone, and sorry about missing the meeting or just calling in.
no worries at all.
Yeah.
Just take care of yourself.
I think we all appreciate it.
Yeah, cruises are definitely, they're fun, and it's really
It's a lot of people.
a lot of exposure.
Yeah.
Yeah, it's hard.
And we're definitely seeing a summer spike down in COVID too. For those tests that are actually being done, we're definitely seeing positives now. I haven't seen any in months, and the summer we've definitely had some, yeah.
Okay.
Yeah.
What I was surprised about is on all three of the tests I took, they turned positive in less than 30 seconds.
Wow.
I had never heard of that before, but again, I had never tested positive before, but they all, and then my wife took 2 and hers were negative. So.
Right. So you'd never tested positive through all this? Wow.
I've never tested positive for COVID.
Huh.
And being that I had access to a lot of free test kits, I had the opportunity to test. I had the opportunity to test myself quite often in hopes of a 5-day vacation.
Yeah.
Wow. Yeah,
but no, all through.
It'll pass quickly.
All through COVID, I never tested positive.
Wow.
Yeah.
That's
I
remarkable.
didn't either.
Really?
And my whole house had it.
But it was late on for me. It was about a year ago, maybe.
Mm-hmm.
I was a late one too. That was everyone, my kids had gotten it, and then my husband, and then I didn't, and then, it was after I got the second booster, I got it, which was crazy.
Mhm.
That was very early on, April 1st, 2020.
Oh, no way.
Yeah, nothing since,
Oh, good.
despite all the exposures I've had.
Right,
I just
oh,
remember
that's,
being in the hospital, I was going to see patients, and I would put on the mask, the N95, and I was like, it was like I was putting on like a hazmat suit and it took forever to see patients, because you had to go around.
right,
Somehow I thought for sure I would go
Yeah.
for this,
Yeah.
but I never did, and then.
Now we go on with nothing and having
Yeah.
fun, so.
Okay.
All right, thank you all very
Thank
much.
you.
Right,
Thank you, everyone. Have a good night.
yeah,
I feel better.
okay.
I love the official.